In Campbellton, New Brunswick, a healthcare system that was struggling before the pandemic has become even more short-handed. 4 doctors have moved away since 2020, leaving thousands of patients without a family doctor. The most notable departure, Dr. Jean-Robert Ngola. He was accused of breaking COVID-19 lockdown rules and of spreading the virus to his patients.
There are physicians who feel very uncomfortable with the situation, and some have actually, I don't know if the Dr. Ngola case specifically did this, but they've moved elsewhere because of the racism that they've experienced.
Angola is suing the New Brunswick government, the RCMP, and Facebook, alleging he was falsely scapegoated after providing health care in Campbellton for 7 years.
Who attack you? Your patients? The populations? The government? Your hospitals?
Dr. Ngola is not fighting for justice alone. He has the support of a large number of colleagues. More than 600 doctors across Canada wrote a letter to New Brunswick Premier Blaine Higgs, asking Higgs to apologize for his part in 2 investigations of Angola, both of which were dropped. Advocates for immigrants fear the treatment of Dr. Ngola, an immigrant from Congo, could undermine New Brunswick's ambitious efforts to bring in 10,000 newcomers per year to fill labor market shortages.
Well, it's definitely bad PR. It doesn't help. And the moment that you do things differently or bad, we're going to be rejecting you. That's not what true inclusion means to me. That's not what we stand for as Canadians and New Brunswickers.
Premier Higgs suggests there's nothing to be afraid of.
Well, I would suggest that if all the facts come out in a proper hearing, and if it has to be a court challenge, and then that's I guess where it's headed, that will allay those fears.
Meanwhile, the province has made an urgent plea for doctors who can help with New Brunswick's pandemic response. Ross Lord, Global News, Campbellton, New Brunswick.